Breaking news, bariatric surgery versus Wegovy weight loss and ZEPBOUND weight loss. Hi friends, I'm Elizabeth, Countess of Shopping. I'm here on my vacation edition of our GLP-1 coverage, having lost over 90 pounds in the last 17 full months of being on a GLP-1 medication. I have been on Mounjaro because of the Mounjaro shortage, on ZEPBOUND because of the ZEPBOUND shortage, and now on tirzepatide. And I'm really excited in today's video to talk about a new study that has come out, scientifically based. And as always, I will cite my sources. I do require of myself being factually accurate. So I will cite my source today down in the description link below. Just click that ... more button. And then you can also see all of my free resources for GLP-1 medications. Let's go ahead and dive in. There's a new study that came out. This article I'll post is June 12th, 2024, about GLP-1 drugs like Wegovy and Zepbound are actually less effective than weight loss surgery. When I saw this, friends, I clutched my pearls. I said, no, it cannot be. So let's dive into the data and see, is it really or is it really? So basically, a new research found that metabolic and bariatric surgery resulted in greater weight loss compared to two GLP-1 drugs and lifestyle modifications. The bariatric surgery is a one-time procedure while people need to continue receiving weekly injections of GLP-1 drugs and maintain the most of weight loss. Doctors continue to use all three types of treatment depending on a patient's specific situation. So with this, metabolic and bariatric surgery led to a greater weight loss with two newer anti-obesity medication drugs and lifestyle modifications, also providing long-lasting results and new research it shows. This preliminary study, and I'll also link separately that preliminary study down in the description link below too, because it's fascinating. Researchers reviewed early studies looking at the benefits of the types of treatment for weight loss, and they found lifestyle modification such as diet and exercise resulted in an average weight loss of 7.4%. People generally regained this weight back in 4 years. Hello. Is it just me or is it me? I mean, I regained weight back on every single diet. And I don't know about you, but Jenny Craig, Weight Watchers, Nutrisystem, you name it, you insert the diet, I did. So no shocker to me there that people gained the weight back, because most people do. However, in contrast, this study showed people lost more weight with GLP-1 receptor and agonists or metabolic and bariatric surgery and kept the weight off longer with surgery, providing the best results. So it goes through, this study was presented on June 11th, 2024 at the American Society of Metabolic and Bariatric Surgery, ASMBS 2024, their annual scientific meeting. The results, though, have yet, and I think this is an important part, to be published yet in a peer-reviewed journal. But in the study, researchers conducted a systematic review of studies that examined weight loss through GLP-1 medications like semaglutide, which is Ozempic, and Wegovy, or tirzepatide, meaning Mounjaro and Zepbound. Lifestyle medications or the bariatric surgery, meaning gastric bypass or sleeve gastrectomy. This included 4 randomized clinical trials looking at the benefits of GLP-1 drugs, 8 studies on lifestyle modification, and 35 studies on metabolic and bariatric surgery, including 2 randomized clinical trials on surgery. This study had, do you want to guess how many patients it had? 20,000 patients combined. After 20 weeks, now, this is where you and I both know. Well, I'm not going to talk about my opinions. Stay till the end. I'll talk about my opinions there. But the study said after 20 weeks, so what is that, 5 months of weekly injections of GLP-1 medication, receptor agonist, semaglutide, people lost on average 10.6% of their weight. After 36 weeks of a weekly injection of tirzepatide, another GLP-1 drug, people lost on average 21.1% of their weight. Tirzepatide also targets another hormone, so it's the secondary one, the GIP, making it a dual-acting drug. Those who continued to receive semaglutide injections plateaued at 17 to 18 months at weight loss of 14.9%. Those who continued on tirzepatide plateaued at 22.5% of weight loss over the same period. And it goes on in this article talking about how obesity is a chronic and complex disease. Most medical therapies and for chronic diseases like hypertension and elevated cholesterol, if you discontinue effectiveness of treatment, the patient has the disease, experiences the disease reoccurrence. And that was by Dr. Jamie Ambelez, an associate professor at UT Southwestern Medical Center, Department of Internal Medicine. So this is fascinating to me. This is fascinating to me and probably fascinating to you too. A couple of thoughts off of this, and then we're going to go back into the data and we can nerd out over the data. Let's nerd out over the data. Is we know that semaglutide, meaning Ozempic and Wegovy, slightly less data in general than tirzepatide, Mounjaro versus Zebpound. So no shocker there that the stats are different on that. Where I question on here is that it had up to 20 weeks within this. But then it goes on to talk about the plateau point. So that was going to be my first thing is like, well, at 20 weeks, for me, I've been on 17 months. For my personal, I'm not a medical person. This is simply my experience, strength, and hope. And my medical, I don't have that. But I do have my experience, strength, and hope of 17 full months on a GLP-1 medication. And that 20 weeks, I wasn't done yet. I was not done yet with my journey. And so that's something I think to keep in mind with this. I do think also, but then it goes on to talk about how basically capping out. People plateaued at 22.5% of weight loss over 17 to 18 months. Semaglutide, they capped out at 14.9% at the 17 to 18% mark. So something to think about if you're on a semaglutide, if you're capping out and you still want more, like you can go up. People have asked me why I don't switch over to Wegovy, and it's for that exact reason of why I'm a little bit gun shy for that is because tirzepatide, Mounjaro, Zebpound, slightly more data for weight loss, right? And it just says it there too. But it's interesting that it's capping out at that 17 to 18 months, which is where I am right now. And if you've seen any of my other videos talking about weight stalls that I've encountered. Now, one of the things that has dramatically helped me with my weight stall and pushing past it has been tracking my sleep. I don't have my Oura Ring on right now. I needed to charge it while I was filming this video, but I have scientific data from my body of sleep and how much it increased because of using Bioptimizers magnesium breakthrough. I had started my GLP-1 journey taking a magnesium because I knew I needed it. So many people recommended it. So helpful on the weight loss journey, helps with leg cramps, helps with sleep, helps with anxiety. I mean, there's a ton of stress reduction. There's a ton of scientific data as to why magnesium is good. But I was taking a different magnesium. It had one type. The reason why I love Bioptimizers is it actually has 7 types included, dramatically changed my sleep. Now, of course, before you take any sort of supplement, always talk to your own healthcare provider. I'm not one. This is simply my experience, strength, and hope. Made a big, big difference in my sleep. Thus, then, my sleep, it affects everything. Working out, eating choices, mental faculties, my mood. I mean, it just is a waterfall of other things that it affects. So getting that proper sleep, very, very beneficial. And I can show my data. My sleep score was like late 60s, early 70s on the Oura Ring out of 100. And now I'm running in like mid 80s to early 90s in my sleep score. What's the transition? Bioptimizers. That's simply that's my experience, strength, and hope. But I'm super, super grateful for magnesium as an option with it. And it also has on there, and one of the other benefits of magnesium is there are over 600 different biochemical reactions in the body. It does help to promote healthy sleep, meaning you fall asleep faster, stay asleep longer, and have more peaceful nights as a result of this too, in addition to supporting stress management, boosting energy and mood while promoting relaxation and mental calmness. Now, I, again, can track that on my Oura Ring. It tells you your stress management with Oura, like day and night. When I switched over from the magnesium I had been using with one type versus now the 7 types, game changer for me. And now I've been on it for so long, I'm obsessed with it. It supports muscle recovery and cramps, builds strong bones. I mean, there's a lot of data going back over to that. So if you were like me, I used to get really horrible leg cramps. I don't. That magnesium has very much helped with that. And then, of course, it helps to promote healthy blood pressure and normal heart rhythms. So one of my options that I strongly encourage with a weight loss journey for me that's worked out really, really well. Let's go back over to our data of how metabolic and bariatric surgery affected weight loss. So we had ended with saying for tirzepatide, And semaglutide, after 17 to 18 months, it was 14.9% of weight loss for semaglutide. Tirzepatide, 22.5% weight loss over the same period of 17 to 18 months. I need to clock mine. I need to look at my percentage. Now that you should tell me down below if you have your percentages. I'm super curious. Are you falling in line with that if you're at the 17 to 18 month mark? I'm curious. But here with the gastric and bypass and sleeve gastrectomy led to average weight loss of 29.5% to 31.9% 1 year after the surgery. People maintain weight loss about 25% for up to 10 years after the surgery. So we go from tirzepatide, which was 22.5% weight loss for 17 to 18 months, versus bariatric a gastric bypass and sleeve gastrectomy. But after 10 years, 25% of weight loss. Bariatric surgery includes more long-term metabolic changes than GLP-1 drugs because the drugs leave your system within a week, says Dr. Mir Ali, MD, a bariatric surgeon and medical director of Memorial Care Surgical Weight Loss Center in Orange Coast Medical Center in Fountain Valley, California, who was not involved in the study. People who have regained some of the weight after bariatric surgery still have some protective effects against diabetes and other conditions due to the metabolic changes. People can regain weight due to a variety of factors in there as well. And people who are good candidates for metabolic and bariatric surgery of effective treatments have a BMI of 40 or more. Those with a BMI of 35 or more and a serious obesity-related health problem like type 2 diabetes, heart disease, or sleep apnea. And we know from my other videos too, we've been talking about how GLP-1 medications have very much helped with sleep apnea type stuff too, which is helpful. Hoping my camera is in view. We're on vacation edition here, so hopefully you guys are enjoying the oceans right behind me, by the way. There's the ocean right there. So let's keep going on this. In 2022, nearly 280,000 people had metabolic and bariatric surgery, according to ASMBS. This, said Ali, represented only 1 to 2% of people who are eligible for these procedures. There's multiple factors in it. And then the article goes on. It's fascinating to me because there's still so much we don't know, and there's so much we do know. We do know that there's FDA approval for Wegovy was FDA approved because it's 20% reduction in strokes, cardiovascular events, heart attacks. It's Zebpound is doing studies for sleep apnea. There's a ton of data coming in about non-fatty liver disease, non-fatty kidney. I always get the kidneys and liver, both of which are being studied, but one is the non-fatty type. Forgive me again, I'm not a healthcare provider, but with these though, and I do know from people sharing about it, about the transfer of addictions, so to speak. And I think it's something that's not mentioned in this article. I'm looking for it as I'm going through. There's so many instances of alcoholism shifting from bariatric patients over to alcoholism. And I think that that's an important conversation we're going to continue to have on the GLP-1 journey of transfer of addictions. But it's not necessarily, for me, I've talked about this in great deal, the brain changes that a GLP-1 medication has given me. There's all these studies coming out about people not wanting to smoke as much, or obviously eat as much, drink as much, shop as much. I mean, there's a lot of other things. And that to me is a brain change where it doesn't sound like, in my opinion, that you have that with bariatric surgery. And so this article is not tipping on that. And I think that's a really important point to put out there. So I'm going to put it out there, and then I'm going to throw it out there, close the door, and then we'll come back to it. But this article goes on and talks about which is from Healthline, by the way, an individual, and I'll put the full link, as is my free meal plan, by the way. If you haven't gotten in my free group, my free meal plan, take advantage of all of my free resources for you listed down in the description link below, my gift to you. But going through this article, it talks about these treatments are used alongside of each other. Now we encourage people to lose weight before surgery with a diet, and it helps to get things jump-started. And so is there a combination of using both of these things? Both. I've talked about this before. There's a brain study about how it's a higher form of intelligent when you come up with both solution, not black and white, not either or, but both. And so I find that interesting. Is there a both part of these too? Researchers, and this is the biggest takeaway, reviewed previous studies looking at weight loss benefits of metabolic and bariatric surgery, gastric bypass, and sleeve gastrectomy, lifestyle modifications, and GLP-1 receptor agonists like semaglutide and tirzepatide. Bariatric surgery provided greater weight loss to other types of treatment with long-lasting benefits. Doctors recommend one or more types doctors may recommend more than one type of treatment for obesity. So one thing I think to mention here too is the price component of how expensive, with now not having health insurance, a lot of them not covering it, the access because of the shortages to GLP-1 medication. Like with bariatric surgery, you do it once and then you have the surgery once. You're not weekly looking and hunting for these medications, which we've had so many conversations on the Wegovy shortage and the Zebpound shortage. And so I think that's an important piece of this too, of this pie, is access to care. I use Join Fridays for my telehealth company. And so having them do my prescriptions, I'll link their information down below, how you have that versus a permanent solution. And for me, my doctor, when I looked for bariatric surgery, I did not feel peace in my heart about doing that, which is why I didn't do it. I would have done it a while ago, but I just didn't feel peace in my heart. And then come to find out this technology came several years later of these GLP-1 medications, and it's amazing. But it has its own drawbacks too. There was the new study out about how 58% of people from Blue Cross Blue Shield is the source on it. And I've done other videos if you want to see my other citing my source on all this. But 58% of people stop taking GLP-1 medications after the first month, which blows my mind. So you're not getting these long-term meaningful benefits like you would for bariatric surgery. And so I think that that's an important piece of this conversation. And my biggest takeaway is talk to your healthcare provider. Find a healthcare provider you trust, find a healthcare provider you love, and be able to have those ongoing conversations as you go through. Because with GLP-1 medication, you need to be able to talk about healthcare, about side effects. You need to be able to proactively be like, gosh, I'm having massive constipation. For me, by the way, with my Bioptimizers, constipation is not an issue anymore. The magnesium, it has in there one of the types of magnesium. People always talk about it in my free group. But it's I don't have that constipation issue, but that is a big issue for people. There's the gastrointestinal side effects of GLP-1 medication. So making sure, and the point is to talk clearly with your healthcare provider, one that you trust, to be able to access these different resources. So I found this article fascinating. I think it's an ongoing conversation. I also want to make sure there's no better, no worse. It's what's best for you. And at the end of the day, your health, your care, your life. And I want to make that one of the biggest takeaways, just because I have had, my life has literally changed. It's been a miracle from GLP-1 medications. I want whatever works best for you. And long-term too, right? As part of this of making, sorry, I've got fuzzies on my face, making meaningful lifelong changes. And that's what Eli Lilly, the manufacturer of Zepbound and Mounjaro, tells us, is we have to make these permanent lifestyle changes with food and with activity level. So sweet friends, run to get your extra discount using the discount code QUEEN and Bioptimizers down in the down in the description link below. Go ahead and take advantage of those savings. Your accountability question today is, what are you doing today to move you closer to your goals? And your emoji for today is going to be a high five. High five. That will tell me that you made it this far in the video. If you did, I want to get to know you better because I care. So make sure you put that high five down in the description or down in the comments below. And I will also pray over you. If you don't believe in prayer, I'll uplift you in positive thought. Sweet friends, today was a cool video. I love nerding out over this data. Sweet friends, be kind to yourself, be kind to others. Don't forget to click that like and share video. And I look forward to seeing you for tomorrow's video. Have a great day. Bye guys. See you soon. Bye friends.